Hey, I'm Shiloh. I'm the program director. Thank you so much for, first of all, for your interest in child neurology. We all need you. And second, for taking the time to allow us to introduce our program. So welcome. I'll let people kind of go around and present themselves. We try to have these UNC backgrounds so it can be easier for you to track which one are asked, but there are some in the group don't have this, so we'll go around and introduce.
Hi everyone, I'm Caitlin Bricker. I'm a PGY5 fellow.
How's that? Okay, perfect. I'm Sonia Varghese. I'm a PGY4 child neurology resident.
I'm Nate Wooten, and I'm the PGY3.
Stephen?
Hey, I'm Stephen Pappas. I'm one of the PGY1s.
Michaela?
I'm Michaela. I'm also one of the PGY1s.
Dr. Hunter?
I'm Sunyana Hunter. I am one of the epileptologists in the group, the child neurologists.
Dr. Sejas?
Hi, I'm Diana Sejas. My pronouns are she, her, hers, and I am in neurodevelopmental disabilities.
And Dr. Olden Shipman?
Hi, I'm Dr. Olm Shipman. I am a neurointensivist, and I also run our pediatric neurovascular stroke program.
Peggy, do you want to say anything? Or I can just give you a shout out.
Hi, I'm Peggy. I'm the communications person for the department.
And I think that's it on our end. I'm Dr. Yang. My first name's Jojo. I'm a pediatric epileptologist, and we're so glad that you're here. Please feel free to message me in the chat individually or to everyone if you're having any tech issues. But otherwise, I think Dr. Shiloh can start.
So first, kind of, I know some of you guys have been to UNC and know us fairly well, other less so, but UNC, in my perspective, have a really unique program in that we're situated in one of the best funded research institutions in the country. And we're a state university and a state hospital, which allows us not only to be in the middle of a campus of all of these opportunities with research, but also to truly be a state institution that provide care to the state. And with that, as a child neurologist, it's something that makes us have this ability to provide care to everyone, no matter what is their insurance, which on a daily basis, this is something that that is just great to a situation to be in. For our program specifically, and I always say this to people interviewing, we're part of the neurology department, but obviously as child neurologists, we work very closely with pediatrics. One of the leading pediatrics program in the nation, and very clearly for the culture of the institution, and very striking with pediatrics, the teamwork and support and being part of a group working together is part of the culture of the institution. So it's kind of training at the highest level, having very kind of, as far as clinical opportunities, really this will not be anything that is lacking, but also in a very supportive and team team type environment. So we'll let Caitlin go over kind of more specifics, but I just wanted to just say that kind of all these elements really, I think, make our programs very great opportunity for someone who likes working in a team, in a kind of supportive environment while having all of these opportunities.
Awesome. We are so happy that you guys are here. This is great. Yay, child neurology. So I'm just going to share my screen and share a PowerPoint with you guys. Okay. So just kind of to go over our program, this won't take too long, but just to give you guys like a basic idea of how our program functions. So these are our faculty members. So this is the chief of Peds Neuro, that's Dr. Lee, and Dr. Shiloh, who's just talking, is our program director. And then the Peds program director is Dr. Kenya McNeil-Trice. And again, our epilepsy faculty here. So Dr. Shiloh, Dr. Lee, Dr. Tennyson, and Dr. Hunter, and then also Dr. Yang. So a couple of these people, a few of these people on the call today. And then some more of our general child neurology faculty. So Dr. Fan, has special interest in sleep, neurogenetics, and neuromuscular. We have Dr. Greenwood, who has special interest in neurocutaneous disorders. Dr. Sejas, who's also on the call, so special interest in developmental neurology. Dr. Gershon is a kind of 50-50 research and clinical person. So he has special interest in neurobiology, cerebellar development, and medulloblastoma. So he's our oncology specialist. And Dr. Olm Shipman also on the call today. So she's peds stroke trained, and she's a neurocritical care and vascular neurologist. And then Dr. Trow has special interest in movement disorders. So this is us. You guys have met most of us on the call today. I think we're only just missing one resident who was going to try to make it, Luke, but I think it was on a late shift today. But for the most part, you have all of us here. And then these are our residency coordinators, Sharon Ward and Ashley Miles. So just to give you kind of an overview of what our training looks like, our PGY 1 and 2 years are exclusive general peds training. So that's all you're going to do your PGY 1 and 2 years, except for a little bit of neurology clinic. So you do get to do some continuity clinic with us in your neurology years, which is pretty great. You still have your general pediatrics continuity clinic, but you get to do every 6 weeks or so, you'll have a continuity clinic on the neuro side. So it's really fun for you to actually get your feet wet and get started in the child neurology field. And then your PGY 3 year is where you're going to do all of your adult training. It's going to be split into adult and peds neuro, but you mainly start out your first couple months doing peds neuro. So we don't just throw you into the adult year. We get you started kind of slowly. We do a boot camp, and then you start your adult year in the fall. And then your PGY 4 and 5 years are going to be exclusively peds neuro. So for your PGY 3 year, here's how the breakdown looks. So your PGY 3 year, you have to give 6 months of adult neurology. These are kind of your ACGME requirements. So to do 1 to 2 months of inpatient service, 3 to 4 months of the consult service, and then 2 months of peds neuro. Like I said, that's at the beginning more so. And then you do get 4 months you have to do 4 months of adult electives just to meet ACGME requirements. So you can do some of that your PGY 3 year, and then kind of figure out if you want to do some more adult electives in your PGY 4 and 5 years. So your PGY 4 year, it's 5 to 6 months of peds neuro. It's inpatient and outpatient. And then you have 6 to 7 months of elective peds or adult. So you have quite a bit of elective time, and you get even more elective time in your PGY 5 year. So you'll do 4 to 5 months of peds neuro inpatient and outpatient, and then 7 to 8 months of electives. So in terms of education, like what we do for extra education and things like didactics, so we have daily afternoon didactics with adult neurology, and that's every day at noon. We have a weekly Peds Neuro conference every Wednesday morning, and that's our case conference. We have weekly Peds Neuro specific lectures, and we do board review, so those are our kind of Thursday lectures. And then we have monthly QI lectures, which we try to do every month. And then neurology grand rounds every Thursday morning. So then there's also some other possibilities for lectures. We have these bi-monthly Peds epilepsy conferences, weekly neuropathology conferences, neuroradiology conferences, and neurosurgery or neurovascular conferences. So you're welcome to join those too if you're looking for extra things to go to, or if you're on rotation specifically with those on those electives, and those are great conferences to join. And as far as our service, so the Peds Neuro service is, as an inpatient service, is primarily consults, even on EMU admissions. So there's always 2 residents on the Peds Neuro service at a single time. Each rotation is usually 2 weeks on average, and one resident primarily performs the inpatient duties, and the other resident has acute or urgent clinic, kind of a more urgent patient clinic in the afternoon. So that's kind of how we split up the duties. And call is home call. It's split equally among the inpatient residents. So we'll split up half and half the week for call. And then when you're on home call, we get calls from the emergency room, the inpatient services, and UNC patients or caregivers, parents, so mommy calls. And that's kind of a little bit different from other institutions. So you don't have to take a bunch of transfer calls, calls from outside hospital EDs. You're primarily just getting more mommy calls and calls from like the inpatient service or the ED. And then I just threw some pictures in here, why we love North Carolina. We're a couple hours from the mountains, a couple hours from the beach. It's a wonderful place to live. The campus is absolutely beautiful. For those of you who haven't seen it, it's pretty stunning. And we do have sports that usually we're able to go to, but not lately. But it's a pretty convenient area to live also. So it's called the Triangle area because Chapel Hill is situated kind of in a triangle with Durham and Raleigh. So it's about 15 minutes to Durham, 25 minutes to Raleigh, and Raleigh's a really nice big city. So if you're looking for more of that big city feel, then Raleigh's a great place to have an option to go to and do like weekend things, fun weeknight things. And then a lot of our residents also live in Durham because it's so close and it's just a little bit less expensive than Chapel Hill. So really great living options and great options for families. And you have plenty of opportunities to do things like research, go to national conferences. So last year when we were able to travel, all the child neurology fellows were able to go to the conference. We had that week dedicated to go to the conference and off of our clinical duties. So that was really great. And we have funding from our university to go to any of the conferences that we want to go to. And we also do a lot of other fun things like this Camp Carefree for epilepsy week. You can go and work there and be the doctor there in the summertime. And then plenty of research opportunities. Again, if you're presenting anything, the university sponsors you to go and present your poster, and they pay for travel and things like that. So that is it. If anyone has questions, let me know. But I'll give it back to Dr. Shiloh.
So if anyone has kind of any specific question they have for us, if not, we may kind of let some of the faculty present some of their specialty and unique opportunities with their group.
Hi.
Oh, sorry.
Oh, sorry. Can you discuss the teaching opportunities that are available for residents and if they're involved in medical student education and just opportunities available to you guys?
Sure. I'll actually let Caitlin go over that. There are quite a lot, yes.
Yeah, hey there. So yes, we do a lot with the medical students. We do a lot with other residents. So in terms of medical students, when they're on a neurology rotation, they have the opportunity to rotate with us. They spend a lot of time in clinic with us because that's part of their outpatient clinic requirements are to spend some time with us in clinic. So they do spend more time with us, I would say, in clinic. And then when we're on the inpatient service, probably every two weeks or so, we do didactics teaching for the pediatrics residents. So that's where the child neuro fellows kind of pick a lecture to give like high yield topics and give a lecture to the peds residents. So we have the opportunity to teach them there on things that they feel like they need to hear more about. And then we also have the opportunity to teach some lectures to med students for like lunchtime lectures and give them those. So I know a few of us have done that. But yeah, there's plenty of teaching opportunities, plenty of interaction with med students.
Oh, thank you.
I have a question. Is there a formal mentoring program for new residents?
Yeah, so we have, every resident have a faculty mentor that, that throughout the years, this is including the years in pediatrics, works with them. We try to select person that kind of their background and their interests align with the resident, but yes.
Hi, I had a question. What about research opportunities like clinical trials or basic research, but more towards clinical research?
There's a lot, and actually I'll say that the one of the greatest challenge is to decide what are the things you're interested in, because there's so many opportunities, and maybe I'll let Dr. Hunter talk about that a little bit, because she can give you some more specifics, but being part of UNC, you'll have multiple opportunities. It will be more of choosing what do you want to spend your time, what really interests you.
Yeah, at UNC there is opportunities both from the standpoint of doing bench research. You can do clinical research, or you can get involved in clinical trials. And as Caitlin went through, you have a lot of elective time, both in your 4th and 5th year. You also have time starting in your pediatric year. So if you're interested in research, this is a great institution because there's a lot of research, neuroscience research, and other types of research going on. So you, as Dr. Shallow said, you can pretty much pick your interest and then we can help you foster it. So it's just about figuring out which type of research you want to do. I am a clinical researcher, and so that's why I picked this institution, but we can help you get involved here.
Thank you.
Yeah, and to go back to the elective time, so the requirements for graduation has specific months that you need to do in adult neurology, in child neurology, and there are 12 months of elective. This is the national requirement to graduate with, you know, to sit for the boards for the ABPN. Out of the 12 months, there's 1 month that is defined that you need to do in ped psychiatry. So this is not negotiable. Every institution has to give a month. This is part of the requirement. For the rest of the 12 months of elective, we are very flexible with that. So really people decide the track that interests them, and can take, we do think that you need to do a few rotations. So neurosurgery we think that is important to do, radiology, and where's the third one? I'm now blanking on. But you're left with about 8 months to pick whatever you want. And people really do very different, choose very differently and guide what they want to do for their kind of later education. For example, if someone is interested in epilepsy, they can spend more time reading EEGs and getting really kind of ahead with that. The resident that just graduated this year was really interested in neonatal neurology, so he did electives in that field. So it's really open, and it's a from what I hear, fairly unique for UNC, that it's really these months are at your choice of elective.
I think Dr. Hunter is muted.
Can you hear me?
Yes.
Okay. We have a great question in the chat asking you to speak about the virtual interview day.
Don't you know how much I stress about this? I'm not of your generation. This is really tough for me. No. So what, it's going to be a mixed day of, and I'm just finalizing the dates and then we'll put it all up. But it's going to be a mix with pediatrics. So some of the sessions will be joining pediatrics, some of their education sessions, the introduction where you go through kind of the specifics of the training in pediatrics, meeting with the pediatric chief. So some of it is with pediatrics and some of this of the day is with us. Specifically the interviews are just 2. Each candidate will have just 2 one-on-one interviews, and then a couple of meetings which are with residents and with kind of with different groups of leadership and residents. Does that answer? And I'm crossing fingers that the technical side will work well. Of kind of jumping between these sessions, but we also had built-in breaks because we all know how tough it is to be for hours and hours between different meetings. So there are built-in breaks and kind of going between these 2, and the actual interviews are just 2.
Hi, I have a quick question. I was wondering if there's opportunities at the resident level to participate in some like multidisciplinary clinics, like for muscular diseases, working with orthopedics, that types of thing?
Yeah, I can answer that. So definitely on the adult side, there's the neuromuscular clinic where they do like a myotonic dystrophy clinic, and it's a very like multidisciplinary kind of with like PTOT. I can't remember everyone who it works with, but yeah, that one's a kind of cool clinic to go to. Another one is on PM&R, so they do a spina bifida clinic, and that's great. You'll work with like neurosurgery, ortho, urology, and PM&R. So yeah, there's some opportunities to do multidisciplinary clinics.
And I don't know if Dr. Sejas wants to tell us more about the CIDD. They have great multidisciplinary clinics there, like the Angelman Clinic.
Yes, so, and I'm sorry, I was trying to jump in, but I'm also live tweeting this and trying to type at the same time. So yes, I work at the Carolina Institute for Developmental Disabilities. Both I and then one of our other faculty members, Jamie Capel, who wasn't able to be here tonight. And we really work in the world of any kind of neurodevelopmental disabilities. CIDD is a facility that's basically, its main focus as far as clinical activity is concerned is multidisciplinary clinics. We have some team clinics there that are disease focused or condition focused, I should say, like Angelman's Clinic, Prader-Willi Clinic. We have a brand new Duke 15 clinic, which I'm very excited about. We have a neurogenetics clinic that's really focused more on psychological assessments. We have several autism clinics that are based by age. They're autism evaluation and assessment clinics for preschool, school-age patients, and then also for older adults. And then we also have some kind of hybrid clinics, which are unofficial, I guess. That's basically me working with one of our psychiatrists who works in neurodevelopmental disabilities, where we share patients who have really complex epilepsy and also complex psychiatric disease, and see those patients together. So yeah, there's all kinds of opportunities, and we always love to have you. And our teams there are usually, either I or Dr. Capel will be involved. Our psychiatry team will be involved. We have psychologists, PT, OT, speech therapists. Depending on the clinic, genetics and genetic counseling may be on the team, and also social work and sometimes patient advocates as well.
Great, thank you so much.
Dr. Olm-Shipman, while we're on like the faculty giving special shout outs, would you like to talk about your area of expertise?
Sure, yeah, so I'm Casey Olm-Shipman, and for those of you who joined, I'm a neurointensivist and stroke specialist. So I trained in pediatric neurology, and then did my fellowships in stroke and critical care, neurocritical care. And I do kind of a mixed practice of adults and pediatrics, and definitely welcome anyone who's interested in doing a rotation in neurocritical care. And then also with the pediatric stroke clinic, this is a clinic that is relatively new and is still growing. And we see, you know, because there is not a centralized pediatric stroke program in North Carolina, we are one of those places where we really get a lot of the very complex cases. And so this is really wonderful, you know, in terms of interdisciplinary care. We work very closely with our neuroradiologists, our neurointerventionists, our stroke team, as well as our neurosurgeons, for example, for some of our Moya Moya cases. So we have lots of opportunities for you to be involved and to be part of the clinic, and part of, as well as part of scholarly activities. My focus outside of my clinical work is quality improvement and safety. So I work with a lot of residents and faculty who are working on projects across the department in different quality improvement areas. So for example, some of the projects that residents have worked on have been handoff projects, projects to reduce routine unnecessary testing, projects to improve communication, projects to improve workflow. So a lot of exciting opportunities there as well.
There is, oh, does someone have a question?
Oh no, I was just gonna welcome Luke that just joined us. Do you want to introduce yourself?
Hello, hey, I'm Luke. I'm the second year child neuro resident. Good to see you all.
Glad you can make it, Luke. There's a question in the chat box from Jameen. It's, do we have a cutoff for step score YOG, which I don't know what stands for, Dr. Shiloh?
So usually we consider for step 1 to 100, but it's actually not a very hard stop if you have otherwise kind of very interesting and impressive CV. So in general, step 1 to 100, that's usually considered the only cutoff.
Oh, year of graduation. Do we have a cutoff for year of graduation? Not sure.
In general, kind of current graduates are usually considered first, but it's, yeah, we don't have a set rule for year of graduation. We don't. Thought maybe Sonia can tell some of the advocacy and other kind of interest, how you're using your elective time.
Hi. Okay, good. There's no echo. So I've always been interested in advocacy and trying to reach the underserved population. And there's a lot of need in neurology itself, especially epilepsy. So one of the things, I guess there's a lot of things I like. So that's the tough part, is figuring out, where to kind of hone in and talk to your mentors and see what they recommend. But one of the projects I'm working on is a project in Malawi in Africa to kind of, so basically educate the population about epilepsy. Right now, I was supposed to go to Malawi, but because of COVID, that didn't happen. But right now we're just trying to collect data and see, what are the obstacles, where are the weaknesses, and what should we focus on? Is it education? Is it access to medication? So that's kind of what we're doing right now. But just kind of anything you're interested in, there's always one of the attendings or even several of the attendings who are interested to help you and will guide you. So that's really like anything you wanted to focus on. It can be international, it could be local. I'm also very involved with the Durham public school system with all this COVID, trying to get our kids back into schools. It's been a kind of a disaster, but so it's just been very, very great to have elective time to, do what I enjoy to do with child neurology. So if anybody has any questions, or I can definitely answer.
I see the question about the experience and some experience in pediatrics as well as child neurology. So we all are very aware that the last 6 months or a little more than that were very challenging, and that many medical school were basically went to a standstill for a few months. And unfortunately, many of you who would want to travel and want to do elective, a lot of this just couldn't happen. And child neurology is such a, we're such a small group, and there's so few institutions in the country that have child neurology programs. So we're well aware that many people can be interested in that, but their medical school will not have in the institution child neurology. So I think that, I know the sense of kind of anxiety going into this interview and feeling like maybe we've not done enough. But mostly what we would be looking for is people that are truly interested in this field. Because if that's kind of something that you want to do, and even if you didn't have a lot of experience or recommendations and so forth, just by having this field, something that you were interested in, and we're all are well aware that this is really challenging times, especially when considering doing electives in other places. So yeah, so don't stress about that. From our perspective, don't stress about it.
We just had a question in terms of global health, what all opportunities are there and what are locations that residents have gone to in the past? So Sonia, do you want to?
Yeah, so there's several locations. One of the biggest ones is the Malawi location that I was mentioning. And during pediatrics, a lot of our pediatric residents will go for emergency medicine rotations out there, and they go out for a month. And so that's usually the one that they go to. And I think there's other ones I can't remember, but I can't remember.
There's definitely.
Yeah, there's several other places, and pretty much any place you want to go, you can make your own elective. And if you know somebody at that location, talk to them, talk to your attending. You can make it kind of your own type of elective. So if anybody's interested in a certain area, you can ask us about that or whatever you'd like.
One of the other programs that's new, that's being started by one of our epileptologists and one of our neuroimmunologists is in Lima, Peru, setting up an exchange program in Lima, but definitely sending our residents down there.
And I know that the pediatric neurosurgeon, Carolyn Quincy, Dr. Quincy has the pediatric neurosurgeons have a relationship with a group in Mauritania, and we're working on setting up like virtual case conferences. Right now with COVID, obviously we can't go, but that would potentially be an area of opportunity for you guys in the near future. Okay, so it's 8:40. Dr. Shiloh, do you want the faculty to drop off or stay on for a little bit longer? What would you like to do?
Yeah, I think that, we can probably, faculty can let you guys ask the residents without us around, and they'll tell you the real story. But if there's any question before we drop off, we're happy to answer.
We are really understanding of how difficult this virtual interview season is. And I think back to Krish's question earlier, we're gonna try our best. And of course, there's gonna be technological issues on your interview day. Hopefully not too many, but if you guys have any suggestions for things that we can do to help you get to know our programs better, I know that if I was going through this process like you guys right now, visiting and talking to people makes such a big difference. And the fact that you can't do that, I can understand is very probably anxiety inducing. And so if you have any suggestions, please feel free to email Dr. Shiloh, and I will be happy to work on that.